For children to learn, thrive, and grow up healthy, it takes a whole community. We're here at PS 49 Willis Avenue School, an elementary school in New York City's South Bronx. Students at PS 49 are eager, talented learners, and their neighborhood in the South Bronx is full of rich history, culture, and community. But this neighborhood has also faced years of underinvestment, stemming from structural racism and other factors, and leading to one of New York City's highest rates of poverty. Nearly 30% of all Bronx residents live under the poverty line. When children and their families don't have enough resources, it can lead to many health challenges that make it harder for them to learn and succeed in school. For instance, if a child hasn't had enough to eat, it can be very hard for them to focus in the classroom, or they might act out because they're hungry. If a child has unaddressed vision problems, they might not be able to see in class or read at grade level. And if a child has experienced stress or trauma, it can be hard for them to focus in school, and they are more vulnerable to health issues. To address these health challenges that can keep students from learning and attending school, a nonprofit organization called Children's Health Fund started an initiative called Healthy and Ready to Learn, or HRL.
Hi, we're HRL.
Since 2014, HRL has been stationed at PS 49, working directly with students, parents, and school administrators to help children be healthier and succeed in school. We address health needs rooted in social, racial, and economic inequities by equipping the school with strategies and tools to promote students' health and well-being.
It's been like an amazing and rewarding experience. When we think about some of the kids in this community, some of the, not just the kids, but the families, just not having resources readily available to them, it starts to become like an equity issue. And being able to partner with Healthy and Ready to Learn and have those services here in the school, we're kind of minimizing that equity issue for parents. So that's been like the best partnership.
What the Healthy and Ready to Learn program does here at PS 49 is instrumental. We are in the weans of the fabric of the school community.
HRL focuses on 3 areas: building positive school climates where all students can thrive, building strong foundations for early childhood development and a positive academic experience, and raising awareness about health challenges that impact student learning, which we call health barriers to learning. We use an approach that is strength-based, family-oriented, equity-focused, trauma-sensitive, and data-driven. We work directly with the whole school community to support students' health. For students, we focus on building positive relationships with trusted adults, providing tools for self-managing stress and anxiety, as well as vision and dental screenings.
So many of our kids that got the dental screenings here had never been to a dentist. Had never been to a dentist. And I'm gonna tell you right now, that's a problem, because if you think about how many things dental is related to your overall health, and for parents not to have the awareness that that's important, and for us to be bringing that to them for the first time. How many kids sit in class every day and they don't engage, right? I don't think it's because they don't want to engage. Most kids don't understand, like, your lack of engagement is related to the fact that you can't see the board, right? You can't read the text. And what's amazing is how many kids after the vision screening have to get glasses. And more importantly, how many of them need to be referred for further services that it's not just glasses, and parents just don't know. So it makes me think, if we didn't have that partnership here at PS 49, what would really happen to our children?
For families, we strive to increase agency by fostering a community of conversation. We facilitate caregiver workshops and create accessible materials to support their health and wellness.
Ay, la verdad que yo me siento como mucha en confianza, los talleres siempre nos dan esa confianza, me siento como en familia, porque es lo que ustedes nos hacen sentir a nosotros los padres en los talleres, se siente ese aprecio. Entonces yo siento que de parte de ustedes siempre tenemos yo me siento súper bien, que yo si por cualquier cosita yo tengo alguna duda al respecto al crecimiento, a las emociones o cualquier cosita, yo siempre sé que puedo regresar con ustedes a preguntar. Pero pues gracias a Dios siempre ustedes son excelentes personas que siempre están dándonos todo ese seguimiento de talleres y aprendemos demasiado.
I honestly think they come for the information. So if Ms. Vega does one workshop and it's a bomb, they're not going to keep coming, right? I know she provides great breakfast, but they're not just coming for the food, because I think it's the follow-up afterwards. Like, I think she's helped them become more resource rich. They don't have that, right? And if they do seek it, you're getting it right here. You're not waiting on a long line to get this information.
There was this particular parent that did not agree with the medication that her doctor was giving her child because her child had asthma. And so she didn't agree because it was steroids. She would stop the medication. So she shared that with the doctor during the workshop. So the doctor explained to her why that wasn't good. That when she stopped giving him the medication, that then the lungs won't heal completely. And then her child will have another asthma flare up during that month. So what I saw is that it was like an aha moment for that parent, and it created a better framing for her to think about asthma versus like, I'm sitting down in a doctor's office, I'm relying on my doctor to give me this medication, and probably didn't want to defy the doctor at the moment and say, I really don't agree with this. And so she found in that space to feel safe to ask that question about, or to even say, well, this is what I'm doing.
For educators, we provide in-person, virtual training, and technical assistance to promote a positive and connected school environment.
This year, you guys have been super supportive, super engaged, super dedicated, always coming through, reminding us, there's a workshop, send this out to your parents. And you guys have given us a lot of resources. You even went out your way to speak to parents one-on-one, and we truly appreciate you guys.
And we really love the collaboration amongst the teachers, because we have voices as well, and we appreciate you guys coming to us and asking for our input for you guys' workshop. So we really are thankful.
HRL also supports mental health services for students, which is critical for both student well-being and for their teachers.
Teachers do need it. It can be pretty heavy. Like you have to make sure that the student is getting educated. You want them to read, you want them to write, you want to give them the best material, but you understand at the moment it's like what they need for the emotional part. Like, it's not something that you can do or you've done already and try to put the student back on track, but you have 20 others that you have to take care of. So teachers did seek support from the counselor, had moments where they were able to say what they needed to say. The counselor would advise them and give them support and guidance and what they can do as a classroom intervention. And teachers found that really helpful.
We also have an online resource and training center. This free online library provides resources and interactive tools developed for parents and caregivers, educators, health staff, and school health advocates, and is accessible to everyone. To develop these materials, we take what we learn on the ground at PS49 and other schools, and with partnerships such as the Office of Students in Temporary Housing, South Bronx Rising Together, and United Way of New York City, we create training and resources that are based on real community need.
We look at a person or a child and we just see what's in front of us, and I think Healthy and Ready to Learn has been able to tap into what's inside of them. I see the impact that is made on our families. I see the impact that is made on our students. And in a community like Mott Haven, right, they say we're the poorest congressional district in the United States, but I think with programs like Healthy and Ready to Learn coming into your school or community and bringing parents in to the school to say, this is what we can do for you, this is how we want to help you, this is how it transfers over to your children and make them healthy and whole, I think that's going to help to close that gap just a little bit, year by year by year.
Un excelente programa, taller, excelentes personas, y de verdad yo creo que PS49 está bendecido al tener personal como ustedes. Sí, son un gran ser humano.